We are so happy to be here and to kick off this discussion of the Presidential Innovation Fellows with a conversation about Blue Button. Some of you might have already heard about Blue Button, but in the next couple of minutes, 10 or so, we're going to explain to you why we've done this and what's coming next. So exciting I can hardly talk, but I'm going to try. If you have a parent, if you are a parent, you might have a partner that you care about or a pulse you want to keep going for a long time, then you know what a pain it is to get your medical records. So imagine this situation, just as a for instance. You have an elderly parent, an elderly mom, and she's living in Washington, D.C. a couple months ago. She's relatively healthy, but she's got to take a few meds every day. She's got to remember to do this every day. And all of a sudden, a ferocious storm comes along and knocks out the power to her house. Now, it ends up that that's not really the crisis. The crisis occurs a couple minutes later when she falls down and she has to go to the emergency room, and she can't remember her meds. She's not going to remember the names. She's not going to remember the dosage. She's not going to remember the frequency, how often she has to take it. And you know something? You're not going to remember it either. Let me give you another for instance. What if you're a doc? Imagine you're a doctor and a patient comes in to see you, and the guy seems okay, he seems smart, he seems lucid, he's got a problem, that's why he's there. And you're going through the medical history, and he remembers everything. He's got most of it written down, but not all of it. And you say, okay, it's time for the physical exam. The guy takes off his shirt, and there's a big scar right down the middle. And the guy says, oh, what's that? He says, oh my God, I forgot to tell you. I had open heart surgery a couple years ago. You know, something that would be good to know, right? So now we have these problems. Oops. So now we have these problems of complexity, right? So if you're a doctor, you got to keep all this stuff in your head. You're dealing with hundreds or thousands of patients. If you're a patient, you may have dozens of doctors, and they all need the same information. And you know something? The combination of that complexity, thousands of diagnoses, thousands of conditions, thousands of medication, dozens of doctors, combine that with paper and people, this is a losing combination, folks. This is not where you want to be. But I have good news. The days of having to remember everything or remember where you put everything are numbered. The days of having to schlep around a suitcase, well, I've seen pictures of this, schlep around a suitcase full of the medicines you've taken, your surgical history, the immunizations you and your kids have had, the films of your radiological studies, all that stuff is about to move from physical atoms to electrons as we're going to put it in the cloud. Those days are numbered. In 2010, 2 years ago this month, President Obama announced that the Department of Veterans Affairs, where I work, is going to make the personal health record of veterans available online with something called Blue Button. Blue Button was and is still today an incredibly simple idea. It basically just puts electronic information in the hands of veterans. Safely, reliably, conveniently. Stuff that we all would want for ourselves. So, in the words of President Obama, with the push of a button, your records are downloaded and you can share them with your doctor or with other people you trust. All we did really was put the name where the name is supposed to go, medications in a list of medications, penicillin, even if it wasn't spelt right, goes in the medications part. And sore throat, well, that's a problem. That's maybe why you're in the doctor's office today. We just listed that as well. The trick, this is not a hard technical problem, right? The trick really is to break through the red tape, the can'ts and the don'ts and I don't wanna and what about this and all about that, right? Was to make people aware that it wasn't a technology problem and that the clinical, the operational, the patient impact was immeasurable. And we did. So you might say, well, geez, all you've done is give some silly ASCII file, the kind of file that any person can read on a screen or on a mobile device. All you've done is give that to people and put it, oh my God, you put it in the hands of patients? Really? And yep, that's exactly what we did. We took that file and we said it's available to you, and we've done it now 1 million times. So just a few days after President Obama's announcement, not only did the VA make their Blue Button available, so did CMS, so did DoD, and shortly thereafter, a lot of our private sector partners are now making their Blue Buttons available too. Now today, fast forward 2 years later, thanks to Director Barry's leadership, all the carriers of federal health insurance, all the people that insure all the folks that work for the federal government, they're going to make a Blue Button available. Thank you very much. Large software companies of your acquaintance have readers. Large insurers that you probably know or even belong to are going to open up the floodgates of that data. Last month, 80,000 people, just at the VA alone, downloaded their personal health record. That number is going up and to the right. And as I said, in less than 2 years, 1 million people have already used the Blue Button successfully and happily. Now, if you're Todd Park, you say, 1 million people? That's amazing! We should have some presidential innovation fellows to help make it bigger. And if you're Dr. Farzad Mostashari, you say, it's good. It's a nice start.
It's a good start, Peter. It's a good start.
Farzad?
Thank you.
What are we going to do next?
So now what? The VA brilliantly moved simply to be able to make this information available to veterans. And as we heard, 1 million veterans have downloaded their information. And where the VA led, others have now followed. So how do we take this to the next level? We have an MVP, right? These, for you startup folks out there, this minimally viable product. But it's not really a product. We're not trying to get 10 million of something sold or 100 million. It's an idea. It's an attitude that says it's okay to get your own record. It's an attitude among providers of openness. Openness means letting other people help. When we talk about open government, when we talk about open data, when we're talking about opening, that means letting others help. And in this case, who are we letting help? The patient. We're letting the patient and the people who love them help. So it's an attitude and it's an action. Let's turn Blue Button from a noun to a verb. So I can say, yeah, I was talking to my mom last night. I'm kind of worried about her. Yeah, she's going to Blue Button those scans, and we're going to send them to my uncle. That's what we want to do. We want to make it an action. To do that, we're going to need help. To take this to the next level up. On 3 fronts. That's why we got 3 fellows. Each of you guys got to solve one of these problems, all right? The first is, we got to change those attitudes. You got to know that you can get it, and increasingly, today, right now, you can't. If I go all over America and I say to one of you, ask your doctor. In fact, ask your doctor. Do that. Say, what's in my record? Believe me. Trust me. Trust Leon Rodriguez, the head of the Office of Civil Rights. It's not against HIPAA. It's not against HIPAA to ask for your own records. It actually is your right. But we need to stimulate that demand. We need to have more people asking, saying, can I get a copy of my own records? If you're on Medicare now, you can get a copy of your records. If you're a veteran now, you can get a copy of your records. Increasingly, we're going to work with those who hold the data to change those attitudes and make it available. Stimulate the demand, the attitudes on the one hand, and the access on the other hand. And this is the most fun part. Well, it's the fellow that I'm going to be working with. The most fun is going to be now not just having it be data that, yes, you can print and you can read and you can have and you can share, but things you can do with it now. To have that data, that information and the incentives turn into combustible magic in the startup crucible. To have people help you use your data to do things you want to do. I want to manage my health. I want to connect to other people. I want to manage my healthcare finances. I want to get a second opinion. I want to find a clinical trial. I want to be able to do things. And for that, we need to not just liberate the data, but we need to make it so that those entrepreneurs can come in an openness to that innovation. And that's what we're going to do. So that's our goal, is to take the million and call it a good start and say, how do we take it to 10 million by next year and 100 million 2 years from now?